Hi, I'm David Pope, and this presentation's on acute knee injuries. It's presented by Claire Walsh and brought to you by Clinical Edge.
Today I'm going to talk to you about acute knee injuries. My name is Claire Walsh. As an experienced sports physiotherapist, I've spent several hours, probably accumulating into months and years, sitting on the sidelines of football fields. So I've seen a lot of acute knee injuries. Some of these you will see within minutes of them happening, or you might see them hours or days later in your clinic, even as long as a few weeks down the track. Most acute knee injuries occur in sports that involve twisting and turning, whether it's contact or non-contact. There's a higher incidence in contact sports such as football and basketball, and they're also very common in women's sports such as netball and women's soccer. Becoming proficient in diagnosing the acute knee is important for effective management and for return to sport. I always tell patients that what they do in the very first 24 hours to 48 hours is really going to define the rate of recovery. Some of the structures that will be discussed in today's lecture are the ACL, the patella, the medial collateral ligament, the lateral collateral ligament, the meniscus, and also the articular cartilage, which is the lining of the joint. So let's start with our assessment. The first part of the assessment is going to be history, and recently a prominent orthopaedic surgeon in Sydney stated at a conference that you can diagnose an anterior cruciate ligament injury over the phone. Well, everyone started laughing, but I actually 100% agreed with him. Because listening to the history and asking the right questions are really pertinent to diagnosing the knee. So some of the important questions that you need to ask: what's the injury, contact or non-contact? Could you play on? And if you did play on, how long did you play on for? Did you or anyone near you hear a pop or a crack, or did you feel a pop? And was there swelling? So did the swelling appear immediately, or did it actually come on over the period of a couple of days? And subsequently, have you had any clicking, popping or giving way in the knee? Now, when you ask them about giving way, it's really important to understand that there are two types of giving way. There's giving way that occurs due to twisting or changing direction, so they might turn and the knee collapses on them. There is also giving way that can occur in a straight line, and this is where the knee actually buckles on them, and they might be just walking along and the knee gives way. This is due to a quadriceps insufficiency, and this will happen after a knee injury if there's some swelling or if the knee's weak. If the giving way occurs because of the change in direction, then it usually means that rotational instability is caused by an anterior cruciate rupture. So the answers to these questions will actually give you some idea of the severity of the injury, what structures are likely to be damaged, and whether or not the patient needs an X-ray. If they say to you that it swelled up really quickly or it just blew up, you would suspect that there's a hemarthrosis or bleeding into the joint. Now, if there is a hemarthrosis, there are really only three things that will give you a hemarthrosis in a knee injury. The first one is an anterior cruciate ligament rupture because of the rich blood supply into the ligament. The second thing is a patellar dislocation, and the third thing is a fracture. If the swelling is milder and it comes on over a longer period of time, it's more indicative of some other intra-articular pathology.